Hello friends, this is Dr. R.B. Kushaw, Assistant Professor in the Division of Veterinary Clinical Complex, FVSC and AH at ISCOS Jammu, RS-Pura. Welcome to my YouTube channel, and if you are new to my channel, so kindly subscribe the channel and hit the bell icon for the notification. Today we are going to discuss about the how to measure the size of the heart on a radiograph. So there are two methods of measuring the size of the heart on radiograph. One is the on lateral radiograph by the vertebral heart score, and the another one is the cardiothoracic ratio. So I have already uploaded the video how to measure the vertebral heart score on lateral radiograph. So you could see that video. In this particular video, we are focusing on the cardiothoracic ratio. So cardiothoracic ratio, we can calculate the cardiothoracic ratio by the two way. One is by using the Digimizer software, and another one is just by measuring the width of the heart in relation to the width of the thoracic area on a ventrodorsal or dorsoventral view. First, I will explain how to measure the area of the heart and area of the thorax by using Digimizer software. So you could see here, this is the Digimizer software interface. So I have already selected this radiograph from here, this file. So you could see this is the right lateral radiograph of a young dog. First we select the unit. So unit, this one is the centimeter. So it shows that from here to here on this particular radiograph, it will calculate the 1 centimeter. We select the area, and then first we calculate the area of the heart or area of the cardiac select. So we should measure accurately. So this is the area of the heart. So it comes around 166. So this is 166 centimeter square. Now we select the another color and then select the area and then measure the area of the thorax. So this method described by the Torad and Hassan in 2014. So this value is around 557. So simply we have to divide 166 divided by the 557. So its value is around 29.8%. So roughly you could say it is 30%. So the cardiothoracic ratio is 30%. So normal value for CTR on lateral radiograph is around 27 to 28% in peak inspiration, whereas 30%, yeah, 30 to 31% in peak expiration. So the next question is how to come to know that whether this radiograph has been taken in the peak inspiration or expiration. So for that we have to count the number of vertebral body. So this one is the first thoracic vertebral body. This is the first, second, third, fourth, fifth, sixth, seventh, eighth, ninth, 10th and 11th. So if the 11th thoracic vertebrae, if it is cranial to this lumbo-diaphragmatic angle, then the radiograph has been taken in the expiratory phase. So in expiratory phase, so value is 30%. So here it is also value comes around 29.8%. So this is normal. This CTR value on this for this particular dog. So now let's calculate the value on the ventrodorsal view of the same animal. Yes. So for the measurement of the CTR on the ventrodorsal view or in the dorsoventral view, first we select any color and then measure the area of the heart. So the area of the heart is comes around 88 centimeter square. Now measure the area of the thorax. So this is the lateral boundary, this is the costodiaphragmatic angle, this is the dome shape diaphragm, this is the left side of the costodiaphragmatic angle, and this is the thoracic inlet. So it's 289 centimeter square. So let's divide the value 88 divided by 289. So it comes around 30.44%. So on ventrodorsal view, the normal CTR value as per the Torad and Hassan 2014 is 30% at the time of peak inspiration, whereas the 33 to 34% at the peak expiration. So on ventrodorsal view, how we come to know that the radiograph has been taken in the inspiratory phase. So for that, we count the number of thoracic vertebrae. This is the 13th, 12th, 11th, 10th, and this is the 9th. So if the costodiaphragmatic angle, if the T10, if the T10 is in the line of the T10 value is cranial to the this costodiaphragmatic angle, then it is assumed that the radiograph has been taken in the inspiratory phase. So the inspiratory phase, the value is 30. So here it is also coming 30. So it is a normal. So if the costodiaphragmatic angle, if it is cranial to the 8th thoracic vertebrae, then definitely the radiograph has been taken in the expiratory phase. Now let's calculate the value of the CTR and lateral radiograph in dogs with the actual cardiomegaly. So this is the right lateral radiograph of a dog with the history of the exercise intolerance. So on this particular radiograph, even by seeing that, you can say the heart size, it's very easy to say that definitely this is a case of the cardiomegaly. But let's verify with this CTR value. So we can measure here. So we measure the area of the heart. So this area of the heart comes around 110 centimeter square, and then we measure the area of the thorax. So that's 239. 110 divided by 239, so value is 46. So So now, regardless of whether it is in the inspiratory or expiratory phase, it is, if it is more than 35-36%, so definitely it is a case of the cardiomegaly or increased heart size. So this is the value is 46% CTR, so definitely it is a case of the cardiomegaly. So this is how we could measure the cardiothoracic ratio by using the Digimizer software. The another way of measuring the cardiothoracic ratio on ventrodorsal view by measurement of the width of the heart occupied in relation to the width of the thoracic cavity. So it simply comes in the percentage. So if the value is more than 65%, then definitely it's a case of the cardiomegaly. But if the value is less than 65, so definitely it's a normal. For the measurement of the CTR value by this method, you don't require even the Digimizer software. But since I have already opened, so at least we need measurement. So I use this length measurement. Otherwise, you can do without, you can say, Digimizer software. So first I measure the width of the heart at its maximum width. Now we measure the width of the thorax. So for the thoracic width, so we measure at the angle of the eighth rib. So this is the first, second, third, fourth, fifth, sixth, seventh, eighth. So this one, from here we measure the width of the thorax. So it is 121. So simply here, if I divide 91 divided by 121, so the CTR value comes around 91 divided by 121, so it's 75%. So now you could see it is much more. So definitely it is a case of the cardiomegaly. But this method we can use only for the dorsoventral or ventrodorsal view, not for the lateral view. So thank you for watching the video, and if you like the video, so kindly share with your friends and veterinarian. And if you have not subscribed yet, so kindly subscribe to the channel and hit the bell icon for the further notification.